Hi, my name is Mary Cable. I'm the infection preventionist and microbiology supervisor for Delta Health, and today I want to talk to you about blood culture collection best practices. This lesson works in conjunction with some new and revised blood culture collection policies coming out for both laboratory and non-laboratory personnel. And there's an 11-question quiz following this presentation, which relates to its learning objectives and the guidance outlined in those policies. In this talk, I want to cover the diagnostic importance and basic principles of blood culture testing, proper collection technique to avoid contamination, adequate blood volume for culturing, and which materials to use. One of the strategies we're going to start using here at Delta Health to reduce our blood culture contamination rate is to standardize our collection materials. This means that every time a blood culture is collected, no matter who is performing the collection, the same tools will be used. This is based on guidance published by the Clinical and Laboratory Standards Institute and the CDC and backed by CMS. The contamination rate goal that we're reaching for is less than or equal to 1% per month. And I just want to state that the driving motivation behind these process improvements is patient safety and quality results. So what is a blood culture exactly? What are we doing this testing for? Simply stated, a blood culture is a diagnostic laboratory test used to isolate and identify either a bacteria or a fungus that's causing sepsis. This isolation and identification also allows us to perform antimicrobial sensitivity testing so that we can find the best agent to work against this infection. For adult patients, a full blood culture test should consist of 2 sets, with 2 bottles making up each set, giving us a total of 4 bottles collected for each adult patient. For best results, in each set we use 1 aerobic bottle and 1 anaerobic bottle. This allows us to capture whether it is an aerobic or anaerobic bacteria that is causing the sepsis. Blood culturing is still considered the gold standard laboratory test to detect and confirm sepsis, and optimal blood specimen collection, transport, and processing procedures are critical to ensuring accurate and timely results. What is contamination in terms of blood culture testing? Contamination in a blood culture is any organism that grows but is not a true pathogen. Most often, blood culture contaminants are usually bacteria that are common to human skin, also called commensal flora. These contamination results are also considered a false positive diagnostic result. How does this contamination occur? The most common causes of blood culture contamination are insufficient skin antisepsis before collection, not using aseptic technique when handling your materials during collection, and not disinfecting the blood culture bottles before collection. Unfortunately, there are many negative impacts to patient care which can occur due to blood culture contamination. To start, this is an inaccurate diagnostic test result, a false positive. This can lead to misdiagnosis and unnecessary antibiotic treatment. There's much data to demonstrate the connection between unnecessary antibiotic treatment and an increase in antibiotic-resistant organisms, which cause complicated infections. A false positive blood culture can also increase the length of a patient's stay in the hospital, which adds to both patient and facility expense. But what many might not know is that an increased length of hospital stay can also increase a patient's risk of acquiring a healthcare-associated infection or condition. The longer a patient stays in the hospital, the greater their potential for acquiring and developing a healthcare-associated condition. So these are just some things to think about when preparing for blood culture collection. And this is also why it's so important for us to really aim for that less than or equal to 1% contamination rate. So let's talk about how we can avoid that unwanted contamination when collecting blood cultures. The first step for this and any venipuncture procedure is proper hand hygiene. either with an alcohol-based hand sanitizer or soap with water. And you'll want to be sure to don clean gloves after that. Next, you'll want to make sure you have your materials ready. You're going to have a clean tourniquet, an isopropyl alcohol swab, culture bottles, as many as you'll need, a ChloraPrep applicator, butterfly blood collection device. This is the only collection device that will be acceptable for blood culture collection. 10 or 20 milliliter syringes as needed, and a Vacutainer transfer device. Next, once you have all your materials together, you're going to want to choose your collection site. A peripheral site is always preferred over collecting a culture from a line, especially one that's been in place for any amount of time. If you do need to collect from an intravenous catheter, then that would have to be done at the time of insertion, and you'll want to make sure to use adequate skin disinfection first. You'll also want to make sure to collect your blood culture sample before any other blood samples, and also before any antibiotics are administered. For best results, you'll want to make sure to collect from 2 different venipuncture sites, 1 site for each culture set. This gives us the best chance for diagnosing a true bacteremia. Next, we want to disinfect our collection site, and this is one of the most important components of blood culture collection. When we use sufficient skin disinfection, we greatly reduce the amount of available skin flora that can give us those false positive results from contamination. At Delta Health, we use the BD ChloraPrep applicator with 2% chlorhexidine gluconate and 70% isopropyl alcohol solution. Isopropyl alcohol on its own is not sufficient for adequate skin disinfection, which is why a product with chlorhexidine and alcohol combined is best. We also want to be careful not to contaminate our applicator before applying it to our patient's skin. So to do this, squeeze the applicator's wings together to break the solution ampule before removing it from the sterile packaging. You can use the inner portion of the sterile packaging to apply pressure to the applicator to help saturate the sponge. Also, shaking the applicator after breaking the ampule will help to release the solution to the sponge. Next, apply the solution to the skin with the applicator sponge using gentle friction in a circular motion for at least 30 seconds. To help track your application time, you can set a timer either on your phone or a stopwatch or a laboratory-style timer. You can also sing Happy Birthday 3 times, which should take about 30 seconds. Allow the solution to completely air dry before collecting any blood. This is now a good time to go ahead and disinfect the tops of your blood culture bottles with the 70% isopropyl alcohol swab, and then let those air dry. Once dry, you can open your butterfly device, connect the syringe, and collect your blood culture specimen. The order in which we collect our blood culture bottles can also affect the results, so we want to make sure to do that in the right order. The aerobic or blue top bottle should be collected first, followed by the anaerobic or purple top bottle. Be sure to collect an adequate blood volume for each bottle type. For adults, this means 8 to 10 milliliters per aerobic or anaerobic bottle. And for pediatric patients, this means 1 to 3 milliliters per pediatric bottle. The difference of blood volume needed is based on a patient's total blood volume. Less blood can be taken of pediatric patients, and so specialized culture bottles have been developed to use with them. The amount of bacteria that is found in 1 milliliter of blood in most cases of sepsis is very small, which is why a specific sample volume needs to be collected, which is estimated from a patient's total blood volume. Once collected, we'll need to label our culture bottles. We'll need to use 2 unique patient identifiers or a patient registration label. Be sure to include the initials of the person performing the collection, the date and time of collection, and the site from which it was collected on the patient. Be careful not to apply the labels over the large barcode on the bottle, as these barcodes are used by the analyzer to track specimen data. Gently invert the bottle after collection to prevent clotting, and deliver to the laboratory as soon as possible after collection. These are some additional guidelines I wanted to touch on. Be sure not to touch the venipuncture site after applying the chlorhexidine solution to disinfect the skin. A placement site for an intravenous catheter should also be disinfected by using the 30-second scrub with ChloraPrep or another chlorhexidine and alcohol product. Be sure not to use a glove or any other non-sterile surface to saturate the ChloraPrep sponge, as we don't want to contaminate the sponge before applying it to the patient's skin. I know we've covered a lot in this lesson, and I appreciate your time and engagement here. In conclusion, I just want to reiterate that adhering to protocols helps standardize our practice across the board, which makes it easier for us to assess where we may be having trouble or falling short of reaching our goals. And that way we can continue to work toward them with evidence-based strategies. It also minimizes medical errors and increases the quality of care we can provide to our patients. Anyone collecting blood cultures can make an important and positive impact on patient safety and positive patient outcomes. I'm really excited to see what kind of progress towards our goal we can make with these practice improvements, and I encourage you all to reach out to me with any questions, problems, or concerns you may have regarding blood culture collection and testing. Thank you again for your time. Please feel free to print a copy of the slide notes page that's available with this lesson to use as a reference.